Good evening. This lecture is about chronic bronchitis. Chronic bronchitis is a part of chronic obstructive pulmonary disease and can be defined as the presence of persistent productive cough for 3 months or more in at least 2 consecutive years. Regarding the pathogenesis, chronic bronchitis occur at the level of conducting zone. شنو يعني conducting zone؟ يعني التراكية، المين برونكاي and terminal bronchioles. على عكس الإمفيزيما which occur at the level of respiratory zone which consists of respiratory bronchiole, alveolar duct and alveolus. الconducting zone من اسمه شنو وظيفته؟ وظيفته conduction of air، إضافة إلى ذلك يسوي لنا humidification and defense mechanism against bacteria and foreign bodies. شلون الديفنس ميكانيزم؟ تصير عن طريق الميوكس سكريشن. عندنا بالتراكية and main برونكاي عندنا ميوكس glands وظيفتها تفرز ميوكس. and بالسمول برونكاي and terminal bronchioles عندنا goblet cells همين تفرز الميوكس. هذه الميوكس وظيفته defense mechanism against foreign bodies. The main or distinct pathological feature in chronic bronchitis is hypertrophy of mucus glands present in trachea and main bronchi. يعني submucosal glands راح يصير بيها increase in the size. Triggered by what? Triggered by environmental irritants, mainly cigarette smoking. Cigarette smoking is the most important risk factor or trigger for chronic bronchitis. The other main pathological feature is increase mucin secreting goblet cell in small bronchi and bronchioles. راح تزداد الجوبلت cell تزداد in the number. وين موجودة بالسمول bronchi and bronchioles. نتيجة الهايبرتروفي and hyperplasia إيش راح يصير؟ راح يصير mucus plug. يعني تخيلوا إذا هاي اليومن أوف مين برونكاي وراح يصير الهايبرتروفي أوف submucous gland فراح تفرز هواي mucus secretion. فإيش راح يصير؟ راح يصير عندنا mucus plaque and obstruction of اليومن. In addition to that, cigarette smoking trigger inflammation and recruitment of inflammatory cell. The end result of inflammation is fibrosis of submucosa. يعني إضافة إلى الميوكس بلاك إيش راح يصير؟ راح يصير fibrosis of submucous layer. فإيش راح يصير؟ هم راح يصير narrowing. As a result of mucus plaque and fibrosis of submucosa راح يصير luminal narrowing and airway obstruction. Regarding clinical features of chronic bronchitis, patients usually present with a chronic cough and this cough contains sputum يعني productive cough. Patient with chronic bronchitis has increased susceptibility for respiratory tract infection يعني يكونون معرضين أكثر من غيرهم علما إلى respiratory tract infection. شنو السبب؟ السبب بالميوكس بلاك اللي يسوون obstruction للأيروي. Distal to this mucus plaque راح يصير فد media that enhance the growth of bacteria لذلك يصير عندهم infections. It also has hypoxia يعني decrease oxygenation of tissue and hypercapnia يعني high CO2 level in the blood. The patient with chronic bronchitis are called blue bloaters يعني عندهم cyanosis bluish discoloration of skin and mucous membrane. بسبب شنو؟ بسبب الهايبوكسيا يعني decrease oxygenation عكس patient with emphysema اللي قلنا عندهم adequate oxygenation of hemoglobin. and edema from right side heart failure. patient with chronic bronchitis ممكن يتطورون ويصير عندهم complication اللي هي right side heart failure. Chronic bronchitis usually coexist with emphysema. مثل ما قلنا usually chronic bronchitis and emphysema comes together يعني يجون اثنيناتهم سوا لأنه risk factor is similar for both. Regarding the morphology of chronic bronchitis بالميكروسكوب شو نشوف The mucosal lining of large airway is hyperemic and swollen by edema fluid. يعني نشوف الايرواي الهايبرemic يعني حمراء و swollen يكون يعني منتفخة by الاديما فلويد الناتجة عن الانفلاميشن. وهم نشوف mucus secretion. Regarding الميكروسكوبي راح يصير enlargement of submucous gland, metaplasia of goblet cell and fibrosis of bronchial wall. Regarding the case, we have 48-year-old man with a history of heavy smoking, present with 3 years history of persistent cough and frequent upper respiratory tract infections, associated with sputum production. Physical examination reveals prominent expiratory wheezes and peripheral edema. Analysis of arterial blood gases reveals hypoxia and CO2 retention. 4 months later, the patient expires. Autopsy of the lung reveals enlargement of submucosal glands in the main bronchi, metaplasia of goblet cells, and fibrosis of bronchiolar walls. What is the most likely diagnosis? هسه من الهيستوري عندنا 48-year-old man وعنده risk factor for respiratory diseases اللي هي heavy smoking. Chief complaint هو chronic productive cough for 3 years and frequent upper respiratory tract infection. من خلال physical examination عنده expiratory wheezes. expiratory wheezes يعني abnormal respiratory sounds indicate the presence of obstruction at the level of small airways. and peripheral edema. peripheral edema قد يعني يعكس لنا complication اللي هي mostly right side heart failure. investigation in form of arterial blood gases ABG هاي ياخذون بلد ويقيسون المستوى يعني الأكسجين الكربون دايوكسيد الPH. شافوا هايبوكسي يعني low oxygen level and CO2 retention يعني high CO2 low O2 and high CO2. هاي تحكي لنا شنو اكو respiratory problem و mainly when in the ventilation. 4 months later the patient dies. The autopsy of the lung reveal enlargement of submucosal glands. شوفوا هاي اللايرز هاي اللي الميوكوسي اللي هي بيها شنو الابيثيليوم of respiratory tract. جواها اللامينا بروبريا هاي اللاير thin layer وهذا كله submucous glands صار بيها enlargements. In addition to metaplasia of goblet cells وصاير fibrosis of bronchiolar walls. The most likely diagnosis من الهيستوري عندنا chronic productive cough for 3 years and has susceptibility for respiratory tract infection and the risk factor for chronic obstructive pulmonary disease اللي هو smoking. بالexamination عندنا expiratory wheeze و evidence of obstructive pulmonary disease. arterial blood gases reveal hypoxia and hypercapnia. Well, most specific or significant is the microscopic examination which reveal enlargement of submucosal gland. So the most likely diagnosis for this patient's condition is chronic bronchitis. Regarding the difference between chronic bronchitis and emphysema, هذا summary بسيط للديفرنس حتى ظل ببالكم. The chronic bronchitis are called blue bloaters while the emphysema patients are called pink puffer. The pathology in chronic bronchitis occur more proximally at the level of bronchi and bronchioles conducting zone, while in emphysema pathology occur at the level of respiratory bronchioles and alveoli يعني بالrespiratory zone. Dyspnea or shortness of breath occur at later stages in the disease in chronic bronchitis, while dyspnea occur early in emphysema. Patients with chronic bronchitis are usually obese, while patients with emphysema are usually thin. This regarding the difference between chronic bronchitis and emphysema. Regarding the similarities, both have cigarette smoking as main risk factor or triggering factor for development. Both chronic bronchitis and emphysema may cause pulmonary hypertension. Why? Because of hypoxia. In the later stage, hypoxia or low oxygenation of tissue occur in both chronic bronchitis and later stage of emphysema, and hypoxia results in pulmonary hypertension. Pulmonary hypertension will affect on the right side of the heart, result in cor pulmonary. Cor pulmonary يعني right side heart failure result from chronic pulmonary disease. الرايت سايد هارت فيلر يطلع على شكل bilateral lower leg edema، مثل ما قرينا بالكيسات انه دائما يجي البيشنت عنده leg edema يطلع على شكل هيباتوميجالي، يعني increase the size of the heart. ممكن يصير عنده distension بالneck veins mostly jugular vein etc. يعني complication of both emphysema and chronic bronchitis is right side heart failure or cor pulmonary. وهاي الصورة همينة توضح انه patient of chronic bronchitis obese يكون عنده cyanosis يعني blue discoloration، while patient with emphysema يكون thin or red ما عنده bluish discoloration. And thank you for your listening. Stay safe and study hard.